some water.
What happened?
Aryan has collapsed to the ground and won't wake up.
Oh no, and look over there. There's a bunch of cells rapidly growing. There must be a malignant brain tumor.
Isn't that brain cancer?
Yes, we must get him to the doctor right now and get this checked out. Hello, welcome to CKA Clinic. How can I help you?
Hi, my name is Aryan, and I had a severe headache this morning and I fainted, so I was just wondering what those are related to.
Okay, well, me and my team would love to help you figure that out. I'm a radio oncologist and my name's Adya Kara.
I'm the medical oncologist and my name is Madhulika Raja.
And I'm the neurosurgeon here. My name is Advait Kanitu.
So what symptoms have you been having?
Headaches, loss of balance, and a little bit of nausea.
These are the other symptoms of brain cancer.
Have you had exposure to any dangerous chemicals, radiation, or head trauma?
Trauma? No, but actually I don't think I've had any exposure to radiation or chemicals.
Okay. Is there a history of cancer either in you or your close family?
Cancer. Now that you mention it, my grandpa had cancer, brain tumor to be exact.
So it is possible to develop a brain tumor through a family history of cancer, but it is extremely rare.
There are little known causes for brain cancer, but some that we do know are environmental factors, such as pesticides, oil products, high radiation exposure to the brain, serious head trauma, or having a history of seizures. Age and gender also play a role. Children and older adults around 61 are more at risk of developing a brain tumor. Men are more likely to develop a malignant brain tumor, while women are more likely to develop a primary benign brain tumor. Mutations also play a major role. A common mutation is p53 mutations. The tumor suppressor gene p53 influences the cell cycle, DNA repair, and cell apoptosis. p53 mutations can cause brain cancer when missing mutations or a DNA change results in a different amino acid being encoded into p53, resulting in a malfunctioning protein.
So the best action to take right now is checking if you really do have a brain tumor, and then I can run some tests to make sure what type of brain tumor you have.
Okay.
We must check to see if the brain tumor is malignant or benign. Malignant brain tumors are cancerous, while benign brain tumors are non-cancerous. Malignant tumors rapidly grow and spread into other areas of the brain, whereas benign tumors are slow growing and don't spread. Most brain tumors are usually secondary or metastasis and are caused by cancer cells in another part of the body spreading to the brain, while primary brain tumors originate in the brain.
So the first exam will be the neurological exam, which will be used to figure out what part of your brain may be affected by this tumor. I will be testing how well your muscles, senses, coordination, and reflexes work, and there will be a vision field exam to see if your eyesight has been affected. The test will check your central and peripheral vision, and if there is a loss of vision, that means the tumor has already affected parts of your brain.
The neurological exam consists of many parts. There's the mental status part, which tests the awareness of a person's place, time, and situation. There's the motor function, which tests the muscle power in various muscle groups to assess for any weakness. There's the sensory exam, which checks the ability to feel and if there's a difference between sides. There's the reflexes, which uses a reflex hammer to gently tap different points on the body for movement. There's the cranial nerves. The brain has 12 cranial nerves, and each has its own purpose. They're checked to see if any specific nerve has been affected. There may be tests for smell, vision, facial sensation, hearing, swallowing, taste, shrugging shoulders, and tongue movement. There's the balance and coordination. It checks if you're able to stand with your eyes closed and walk in a straight line, or touch your nose with your eyes closed.
So the exam results reveal you have bad balance, hazy vision, and bad reflexes. Looking at the results of the exam, I think it is safe to say we should go forward and run a brain MRI and a brain biopsy. The brain MRI and brain biopsy confirms brain cancer and if the tumor is cancerous or not. And it will also confirm the type, grade level, and helps decide the treatment plans of the tumor.
The MRI machine creates images of the body using a large magnet and radio waves. It creates a strong magnetic field around the patient, which will cause the atoms in the body to align in the same direction. Then, radio waves are sent to move the atoms out of their original position. When the radio waves are turned off, the atoms will go back to their prior positions, and all these signals are received by a computer that will convert them into an image of the brain tumor.
A brain biopsy is used to confirm brain cancer. It can also tell you the type and grade level of your brain tumor, as well as help you decide future treatment plans. During a brain biopsy, a sample of the brain tumor tissue is sent to the lab where it is tested for cancer. In this procedure, we will use a stereotatic needle biopsy. This occurs when a small hole is cut in the skull and a needle is inserted in order to get to the tissue.
So the reports are back and the tests reveal you do have a malignant brain tumor, which is a cancerous brain tumor, and it is a high-grade glioma called anaplastic astrocytoma.
Oh my god. What is that?
It's a grade 3 tumor that affects the part of the brain called the cerebrum in your frontal and temporal lobe and arises from the astrocytes, a type of glial cell. The tumor is now actively producing abnormal cells and without being treated could eventually recur into a grade 4 glioblastoma, which is the deadliest and most common uncurable brain cancer there is.
So what do I do? What are my treatment options? What are my chances of beating the glioma?
So your treatment will be a combination of brain surgery, chemotherapy, radiation therapy, and maybe even immunotherapy.
Immunotherapy is a new but very promising cancer treatment that uses your own immune system to eliminate the tumor, but most of the treatments are still in clinical trials. There are studies that show that immunotherapy increases the survival rate for patients with advanced cases of cancer for several months, but most research is still being conducted to make this treatment even more effective and is usually given with a combination of chemo and radiation therapy after surgery. One type of immunotherapy treatment is checkpoint inhibitors. Checkpoint proteins block proteins on a cancer cell that the immune system considers friendly so that the immune system can attack the cancer.
Hi.
Hi, have a seat right here. So I'm going to be your neurosurgeon that will perform your brain surgery today. So with these reports right here, it says you'll need a surgery in your extended bifrontal craniotomy. And after the surgery, there will be a period of healing. Then you will come back for chemotherapy and radiation therapy to kill any tumor cells left.
Okay.
A craniotomy is a surgical procedure where a section of the skull is removed to get rid of the brain tumor. It is the most common way to treat a brain tumor, and it is used to treat both malignant and benign brain tumors. The surgery begins when the neurosurgeon uses the location of the brain tumor provided by the MRI scan to make an incision at the part of the brain that is affected. For glioma, the incision will be made in the scalp behind the hairline and removes the bone that forms the contour of the orbits in the forehead. Then the neurosurgeon will remove the tumor and replace the bone. Some side effects to the surgery include infection, bleeding, blood clots, brain tissue injury, vision loss, which is caused by a tumor hitting nerves that connect to the eye, and hearing loss, which is caused by a tumor hitting nerves that connect to the ear.
Chemotherapy is the usage of strong medicines to kill the tumor cells. They may be injected into the vein with intravenous infusion or taken in pill form, and sometimes they might even be put in brain tissue during the surgery. It is done while doing radiation therapy, and some side effects include nausea, vomiting, and hair loss. Some common chemotherapy drugs include lomustine, temozolomide, and vincristine. For high-grade glioma, the drug given is temozolomide, and is given through pills. They're taken once a day by mouth for 6 weeks during radiation therapy. Then patients are given a period of rest for the body to heal, and if needed, will be given a second dose.
Radiation therapy consists of powerful energy beams that kill tumor cells. They can come from X-rays, protons, or other sources. There are different types of radiation therapy, such as external beam radiation. This type usually pulls energy from outside the body and happens in short treatments that can last anywhere from 5 days to 6 weeks. It is delivered by a machine called a linear accelerator. Another type of radiation therapy is called brachytherapy. This uses energy from inside the body. In addition to these two, a third type is called whole brain radiation therapy. This type of radiation therapy is used to stop cancer and other parts of the body from spreading into the brain and developing into multiple brain tumors.
Okay, so your treatment is done and has been successful, but don't get too excited. Malignant brain tumors often grow back after the treatment, so regular follow-up appointments will be recommended to keep track of the tumor and if it is relapsing.
Okay, I'll book appointments. Thank you for helping. There's no way to prevent brain cancer, and we still don't know exactly why it happens.
But we can reduce the risk of developing brain cancer by reducing your exposure to environmental hazards, like smoking and drinking in excessive amounts and radiation exposure.
Come to the CKA clinic to get effective and affordable brain cancer treatment.
Hope this helps. Have a great day.
Bye.